Potter syndrome refers to the association of dysmorphic clinical features and bilateral renal agenesis. The incidence of Potter syndrome is approximately 1 in 4,000 births. Potter syndrome has a male predominance. Failure of renal development in Potter syndrome is associated with oligohydramnios and abnormal lung development. Infants with Potter syndrome usually have severe lung hypoplasia. These infants are severely asphyxiated at birth and often die within several hours due to lung hypoplasia. Oligohydramnios in Potter syndrome gives rise to characteristic facial features, including a beaked nose, low-set abnormal ears, prominent epicanthic folds, and upsloping palpebral fissures. Potter syndrome is usually considered sporadic, but may be polygenic, with a recurrent risk of unilateral or bilateral renal agenesis of approximately 1%. Facial features identical to those seen in Potter syndrome may be seen in other causes of oligohydramnios due to urinary outflow obstruction, referred to as pseudo-Potter syndrome. In pseudo-Potter syndrome, large kidneys are usually palpable. Potter syndrome is a fetal deformation sequence caused by uterine wall compression secondary to oligohydramnios. Characteristic facial features in Potter syndrome include wide-set eyes, depressed nasal bridge, beaked nose, receding chin, and posteriorly rotated low-set ears. Potter syndrome can occur in any infant with a history of severe oligohydramnios, most commonly resulting from obstructive uropathy and cystic kidney diseases. Potter syndrome has a high mortality rate due to associated pulmonary hypoplasia. Surviving infants with Potter syndrome often have significant morbidity because of the underlying renal disease and associated anomalies, such as compressed chest wall and arthrogryposis. Potter sequence is often found in association with prune belly sequence. Potter syndrome is associated with renal agenesis, severe bilateral obstruction, severe bilateral dysplasia, or autosomal recessive polycystic kidney disease, leading to oligohydramnios. Altered facies, pulmonary hypoplasia, and abnormal limb and head positioning are general features of Potter syndrome. Potter facies include low-set ears, wide-spaced eyes with epicanthal folds, flattened nose, and receding chin. Potter syndrome results in pulmonary hypoplasia with pneumothoraces, wrinkled skin, and growth restriction due to oligohydramnios. The initial malformations leading to oligohydramnios in Potter syndrome include bilateral renal agenesis, severe polycystic kidneys, or urinary tract obstruction. Potter syndrome has an incidence of approximately 1 in 4,000 live births. Neonatal mortality in Potter syndrome is very high, with almost all infants dying. Potter sequence includes absent abdominal musculature, prune belly, and cryptorchidism as associated anomalies. Oligohydramnios sequence in Potter syndrome leads to deformations and disruptions, including compression deformities of the face and limbs. Severe lung hypoplasia in Potter syndrome results in respiratory insufficiency and early death. Antenatal ultrasound may detect features suggestive of Potter syndrome, such as severe oligohydramnios and renal anomalies. Treatment options for Potter syndrome are limited and mainly supportive due to lung hypoplasia and renal failure. Potter syndrome facial features are a result of fetal deformation secondary to low amniotic fluid volume. Potter syndrome is a sequence rather than a single malformation involving a cascade of anomalies, starting with kidney failure. In Potter syndrome, the underlying renal disease may include bilateral renal agenesis or severe polycystic kidney disease. Pulmonary hypoplasia is the primary cause of death in infants with Potter syndrome. Potter syndrome is often detected prenatally through ultrasound, identifying oligohydramnios and renal anomalies. Prognosis of Potter syndrome is poor, with most affected infants dying shortly after birth. Potter syndrome may be associated with other syndromes involving renal anomalies, such as prune belly sequence. Differential diagnosis includes pseudo-Potter syndrome caused by urinary tract obstruction with large palpable kidneys. The characteristic facial features of Potter syndrome are secondary to oligohydramnios and include beaked nose and low-set ears. Pathophysiology involves decreased kidney function in utero, leading to oligohydramnios, which in turn causes lung hypoplasia and facial deformities. Potter syndrome is a lethal condition primarily because of pulmonary hypoplasia caused by low amniotic fluid volume. Prenatal diagnosis and counseling are important for Potter syndrome due to poor prognosis and lethal outcomes. Sources: Essential Neonatal Medicine, 2018, p. 492. Klaus and Fanaroff's Care of the High-Risk Neonate, 2019, p. 159. 398, Manual of Neonatal Care, Cloherty and Starks, 2022, p. 414. Avery's Disease of the Newborn, 11th ed., 2024, pp. 1438 to 440. Gamella's Neonatology, 8th ed., p. 6 and 26, inferred. Perinatal Medicine, Diseases of the Fetus and Infant, 2024, p. 7 and 10.